Queensland University of Technology, and Kori will be presenting on speech and language outcomes following treatment for pediatric posterior fossa tumors.
So I haven't stumbled in the wrong conference, but I am going to shift gears and talk about pediatric language outcomes following posterior fossa tumor treatment. So why posterior fossa tumors? Well, in Australia, second most prevalent cancer type in children is brain cancer, and of that group, 60% are in the posterior fossa region of the brain. So this region is the lower region of the brain, including the cerebellum and the brain stem. So for these cancers, we get aggressive multimodal treatment regimes, so surgical resection, adjunctive chemo, and radiation. With advances in treatment, the increase of survival of these children is exceeding 75% at 5 years. So now our focus is quality of survival and focusing on their outcomes. So understanding of neurocognition in the cerebellum has also evolved in recent years. So aside from its role in motor function, as most of you know, cerebellum plays an important role in executive functioning, spatial cognition, personality, speech, and language. So that's phonemic fluency, you've got semantic fluency, verbal fluency, semantic access and verbal fluency, to name a few, obviously. So we wanted to look at outcomes in this population, language outcomes. So, some of you might be familiar with cerebellar mutism syndrome in this population, as it's the most common syndrome reported. So 25% of the posterior fossa tumor patients present with this syndrome, and it's a complication of the surgical resection. So this deficit is in motor and non-motor speech. It's a motor and non-motor speech deficit, but often this is transient and considered resolved in a lot of patients. But Hassel and colleagues investigated patients with CMS compared to patients that didn't have CMS, and found that at 12 months they had poor overall academic performance and quality of survival. However, there's limited evidence into more other language outcomes in these patients, and what outcomes are actually chronic, and so a more prospective look is warranted. So before we did that though, we wanted to look at, we did a pilot investigating the incidence and type of more broader cognitive deficits in a chronic recovery period of these patients. So it's an Australian cohort, and we looked and compared this data with age-matched controls through standardized testing. So we took 37 posterior fossa tumor survivors, retrospective, aged 5 to 14 years. The assessment data was previously collected as a part of a larger clinical trial in 2003 and 2007 at actually the Brisbane Children's Hospital, which was Royal Children's Hospital at the time. The current study took a small selection of the subtests from the Woodcock-Johnson 3 edition, which both cohorts received. And these individual scores were standardized and grouped into some shared categories, and we then compared these scores against the age matched norms for the Australian population. So, what did we find? We found that at 12 to 15 months post-treatment, over half the posterior fossa tumor survivors performed below average on reading and math fluency, and with actually 10 to 20% showing severe impairments. So I'm just highlighting the two, but you can see what's interesting is that there's a relatively higher percentage of impairments on tests of academic achievement overall compared to those of more general cognitive skills. So this data demonstrates a pattern of below average cognitive functioning and skills required for academic success, specifically language and numeracy skills. It highlights the need for a longitudinal, more prospective investigation into risk prediction in these patients, detailed core impairment profiles, and long-term implications for development and survival. So, obviously highlighted a lot of gaps, but so what can we do as clinicians and researchers in this area? So identify some risk factors for post-surgical cognitive deficits. So preoperative speech and language impairments have proposed, preoperative speech and language impairments has been proposed as a potential risk factor for post-operative cognitive impairments. Yet comprehensive preoperative assessment in these patients in speech and language is rarely, if ever, conducted in a clinical setting at this moment. An international working group has recommended that all paediatric posterior fossa tumour patients undergo comprehensive speech and language assessments preoperatively to really determine the risk post-operatively as well. So second is looking actually at the impairment profile. So looking at their core speech and language deficits and their implications for development moving forward. So recent studies have suggested that individual differences, obviously we know that in phonological awareness, which is a critical score for language, is also linked to numeracy skills, for example. So this profile actually fits quite nicely with our data, seeing that the link in reading and numeracy in the post-operative outcomes. However, future research would need to investigate both that more acute and chronic core language skill deficit and using standardized testing, obviously, for language. So future research also need to tease apart the core, these core speech and language impairments from academic success, and account for external confounds like school attendance. One last thing, so improve quality of survival. So high survival rate in paediatric tumours is obviously we need to advocate for this group and work into actually following this group up. Okay, thank you.